Okay, from these complex genetic predispositions, let's pivot to something a bit more mechanical, maybe. Twiddler syndrome. This sounds almost whimsical, but I gather it's a serious pacemaker malfunction.
It does sound a bit lighthearted, doesn't it? But yes, it can be very serious. First described way back in 1968, Twiddler syndrome results from pacemaker malfunction because the patient themselves, sometimes consciously but often unconsciously, manipulates or twiddles the pulse generator under the skin. This repetitive movement causes coiling and malpositioning of the pacemaker leads, typically within the first 12 months after the device is implanted. Its prevalence has been estimated at about 1.2% in high-volume centers, so it's not incredibly rare.
So the patient is inadvertently causing their own pacemaker problems by fiddling with the device.
Essentially, yes. One review found that patients receiving antidepressants were actually more prone to manipulate the pacemaker. While many patients might adjust the device occasionally, maybe to check its position or alleviate some discomfort, most stop over time. However, sometimes patients, particularly those with certain psychiatric conditions, might persist. Another significant risk factor is a discrepancy between the size of the pacemaker pocket created during surgery and the device itself. This is particularly evident in obese patients, as the larger pocket allows more room for the device to move around and potentially be twiddled. Clinically, you might see skin abrasions at the site of manipulation. More seriously, the lead displacement can cause various symptoms. Most frequently, it causes phrenic nerve stimulation, which leads to hiccups or diaphragmatic contractions. Or patients might feel abdominal pulsations or rhythmic arm twitching if the brachial plexus gets stimulated. Critically, the pacemaker dysfunction resulting from this can lead to fatal arrhythmias and even cardiac arrest if the heart relies on the pacemaker.
How does this manifest on an ECG then? What would you see?
Well, the ECG findings really depend on why the pacemaker was put in and how it's programmed. They can range from completely normal readings, if the patient isn't pacemaker dependent at that moment, to complete heart block with loss of capture, meaning the pacemaker fires but doesn't stimulate the heart muscle. Notable signs include the absence of the expected pulse generator artifacts, the little spikes on the ECG, loss of capture, inappropriate pacing, pacing when it shouldn't, abnormal pacing morphology, the shape of the pace heartbeat looks wrong, irregular pacing intervals, and asynchronous pacing, pacing at a fixed rate unrelated to the heart's own rhythm. In cases involving ICDs, the loss of adequate sensing and capture can lead to even more dramatic ECG findings, including failure to treat malignant ventricular arrhythmias or, conversely, inappropriate shocks, and potentially even a systole. The main pillars of diagnosis are the ECG and a chest X-ray. A chest X-ray typically reveals displacement of the lead, often appearing coiled up near the generator device itself. You literally see the wires twisted. Additionally, pacemaker interrogation, checking the device's internal data using a programmer, can identify dysfunction, like high pacing thresholds or sensing problems. It's important to distinguish Twiddler syndrome from something called Real syndrome. Real syndrome is a similar issue but results from inappropriate anchoring of the leads during the implantation surgery itself, where the generator basically spins around its long axis, winding the leads around it. Different mechanism, similar result.
How do you fix this once it's identified?
Treatment requires reoperation. The surgeon needs to reposition the lead securely and often needs to apply additional sutures to anchor the generator tightly to the fascia within the surgical pocket to prevent it from moving again. Patient education is crucial, explaining why they shouldn't manipulate the device. And in some cases, particularly if there's a compulsive element, a psychiatric evaluation might be necessary to help prevent recurrence.